Okay, can everybody kind of see?
Whatever. Yeah.
Okay. So we have multiple organ dysfunction syndrome by Jen, John, and Jay. Jen, John, Jay. So we have complications of any form of shock caused by inadequate tissue perfusion.
Hold still.
Sorry. Here, Johnny, can you hold this? Okay. Commonly occurs towards the end of septic shock. It's not possible to predict, so some people who do have shock don't necessarily get this. Pattern of progressive organ dysfunction and failure is evident, though, so you can kind of watch for that. We have some risk factors,
Advanced age.
which includes advanced age, Johnny, malnutrition, and coexisting disease.
Sure. So the signs and symptoms progressively show up. And the first, the lungs are the first organs to show that they're affected, and it presents with respiratory failure and dyspnea. There's also a hypermetabolic state present, and that is shown by hyperglycemia, hyperlactic acidemia, and an elevated bun. And because of that hypermetabolic state, there's also severe skeletal muscle loss.
7 to 10 days after, though, they get some other signs and symptoms, which include hepatic dysfunction with elevated bilirubin and liver function tests, renal dysfunction, which include elevated creatinine and urea, immunocompromised with increased risk for bleeding. Nursing management, a lot of it has to do with you kind of monitor them and work with the family, but you monitor organ perfusion, provide support and information to the family, address end-of-life decisions, and discuss rehabilitation. Treatment includes family teaching about administering of meds, IV therapy, parenteral and enteral feeding, skin care, exercise and nutrition, and ambulation, because if they do survive the shock or whatever, there's the bone loss and the muscle loss and all that kind of stuff. And there's John, Jen, and me.
Oh, the picture. That's
She posed for it.
It looks good.
Yeah, I was like, wait.
Your computer?
Yeah, absolutely.
Yep.
Nice.
When you guys roll out.
awesome.